Hello, everyone. I would like to inform you all a little bit about my targeted career, which is an oncology nurse. For those of you who haven't heard previously, my passion for the field of oncology derived from caring for my late grandmother who battled breast cancer. A lot of times growing up, I would go with her to her chemotherapy treatments, and as a child, I admired her relationships with her oncology nurses and the doctors that worked at the cancer treatment center that she went to receive radiation. So, growing up, I aspired to be just like the nurses there and provide treatment for people undergoing cancer diagnosis or people undergoing blood disorders that seek treatment for those type of things. So for those of you who don't know or aren't familiar with an oncology nurse, they care for people of all ages, young and old, diagnosed with cancer and blood disorders, for example, such as leukemia and myeloma. They oftentimes support the family as well and educate the families, and they also help them deal with the anxiety of uncertainties brought on by these disorders and diseases. And that of course includes the possibility of death that they have to deal with. Um, as far as educational requirements, oncology nurses have to, of course, obtain their bachelor's of science in nursing degree. And upon completion of the nursing degree, they have to pass the NCLEX exam. And in my research, I also found that for oncology nurses, they do provide 6 different certifications that can be received. For example, there is an oncology certified nurse exam that can be taken, which requires 1,000 hours of oncology RN experience. So certifications like these not only help further educate a nurse seeking a field in oncology, but they also are great tools to help demonstrate expertise. Like I said, oncology nurses provide curative and palliative treatment for cancer and bloodborne illnesses. They, on average, I've researched that they make anywhere from 73,000 to 111,000 at most, depending on their location. They work not only at cancer centers, but they can also be found in hospitals. They can be found in physicians' offices, clinics, and they also a lot of times do home care for hospice patients who are in the terminal stages of their illness. As we all know, we are very familiar with the different types of treatment for cancer, with, of course, surgery being an option to remove a tumor. But what a lot of us fail to realize is that there are many different forms of chemotherapy. In my research, I found that there is chemotherapy infusions, there are shots, there are creams, and there are also drugs that can be administered to treat specific areas of the body where your cancer may be. So there is definitely more than one way that chemotherapy can be given. I know sometimes patients that are diagnosed are kind of discouraged to the sound of chemotherapy because some people are miseducated, and of course chemotherapy can cause damage to healthy tissues, but it is, with especially with the advancements, it has helped narrow down on killing the bad tissue and keeping more of the healthy tissue. In my submissions area, I will attach not only my speech but also a visual aid to self detection for skin cancer, and just a good tool for you all to look at, both male and female. A tool that you all can use, like I said, to detect any changes or abnormalities in your body that you can take to your doctor if you are worried about something. So I hope that you all look at it, and of course, feel free to comment and ask any questions that you may have on oncology or anything else that you may want to ask as far as something that an oncology nurse may do. Thank you for watching.